And we are live. This is with my sixth episode, I think, and I'm here with Dr. Peter Pfeiffer. Did I say that right? Pfeiffer?
Yes, perfectly.
Five dog. Why don't we just jump into the weed?
Sure.
Figuratively.
Out in the weeds.
Figuratively, that's a buttermilk biscuit. Here we go.
Cannabis users had higher pain scores and they needed more post-operative opioids.
Yeah, and there was a study done in our journal, the Journal of Oral Maxillofacial Surgery, in 2023, and they found that, for IV sedations, they found that cannabis users needed more midazolam, fentanyl, ketamine, and propofol. Those are all the things that I use, right? Pretty much most oral surgeons can use those things. So there was a recent study that did find that to be a thing. Until sometimes we get into the sedation, now they're showing up for surgery and they're tachycardic in the 140s, and what did the study say? Like, even when you smoke 3 days ago, you could still have tachycardia from that because it clears so slowly, right? So if you don't know this, marijuana is highly liposoluble, right? So it's stored in the fat cells more so. And so even when you stop smoking or however you're taking it, it's still in your system for a while, right? And I saw one study that said you can even still have tachycardia from it from like a couple days ago. Tachycardia, increase in heart rate. I'm seeing a lot more tachycardia in IV sedation patients. And sometimes, when they're in the room, they're on some medication, you can ask them if they're still awake enough to answer. And a lot of them will tell you, yeah, I smoke weed, don't tell my parents. They'll say things like that. I'm like, yeah, I figured, we can't get you asleep. And your heart rate's pretty high still.
Potency of the marijuana on the street has gone up double, triple, 5 times, depending on the period of time that you're looking at that. It's been going up year over year, making that problem even harder.
Yeah. The first hour after you smoke or however you take it is the riskiest hour for your risk of MI or heart attack, right? It's like a 5-time fold increase that first hour after you smoke weed, let's say, versus cocaine, where I think it's a 24 times. Like you do some coke, you're 24 times more likely to have a cardiac event, despite the stats. Marijuana, 5 times more likely in that first hour of use.
I'm the